perimenopause, and we will be talking a little bit about other things as well. So that's why my presentation is titled To Perimenopause and Beyond. If you have questions throughout, I'm happy to answer them. So you can like put them in the chat or the Q&A. I also have some like quiz questions. If this was in person, I'd give you guys candy or something, but it's not. So, but yeah, please participate. All right, so I don't have anything to disclose and no conflicts of interest. I did just want to bring attention to my use of the term woman and women. It is acknowledged that individuals who don't identify as women do experience menopausal symptoms, and out of respect, we will attempt to use gender neutral terms in the presentation, but if there are any generalizations that are made, just want to say that please forgive them. All right, so our objectives. After this presentation, I want everybody to understand the definitions of menopause, menopause transition, and perimenopause. I'm going to review menopausal symptoms and kind of the physiology behind it. I think it's important to know why we experience the symptoms we experience, and then also talk about some known associations that lead to increased symptoms for certain patient populations. And then we're going to spend some time discussing healthy lifestyle and preventative interventions for our midlife women, and then briefly discuss therapies. Therapies for menopause and perimenopause can be a whole lecture in itself. So that's something that we'll briefly cover. All right, so what is menopause and how will I know if I'm about to go into menopause? So the definition of menopause is the date of your final menstrual period after the absence of periods for 12 months. So if you don't have a period for 12 months and your last period was January 1st, 2023, then that is the date of your menopause. 95% of women will go through menopause between the ages of 45 to 55. And the average age, which is a common question that I get asked, the average age of menopause of Caucasian women that are living in the United States is 51.3 years. So 51 to 52 is the most common age. And then this most important sign that you could be someone who will go through menopause in the next 1 to 2 years is the absence of bleeding for greater than 60 days. So if you start to skip periods and you notice that you haven't had 2 periods in a row, it is possible, and you're in this age range, it is possible that you will go through menopause in 1 to 2 years. All right, what is menopause transition? How will I know if I am close to menopause? So menopause transition is defined as the period of time with persistent irregular bleeding plus menopausal symptoms. So those include the hot flashes, poor sleep, changes in mood, etc. And all of this is prior to the final menstrual period. So it's like the time before your last period. And something that is very unfortunate is that many women enter into this transition without any information about what may occur, which is why I think things like this seminar, certain books that I will recommend, talking to your OBGYN, is very important. So, we're going into this transition period with knowledge and education. What is perimenopause and how long will this last? So perimenopause extends from the years before your final menstrual period when menses are starting to become irregular, and it continues until 1 year after the final menstrual period or menopause. Once you've been no periods for 12 months, you're considered post-menopausal at that time. So that is something to be like just terminology, but that's the definition of perimenopause. And then another thing to remember is premature ovarian insufficiency occurs when your final menstrual period occurs before the age of 40. And this can be iatrogenic, which means if you have surgery to have your ovaries removed, or like chemo radiation that leads to inactive ovarian tissue. And these patients are patients that should definitely be seeking care with their OBGYN, because they would need medications and extra surveillance to make sure that we're not exposing them to increased risk factors for osteoporosis and heart attacks and strokes. All right, so we're gonna have some questions, pop quiz. At what age range do the bothersome symptoms of menopause most commonly occur, and how long do they last? So if somebody wants to put in an answer in the chat, I don't think you guys can talk in the seminar, but any guesses? Oh, we have a guess. Oh, we have a question. The primary reason I'm here, if I've had a partial hysterectomy, no more period, should I assume that I've hit the age bracket that I'm perimenopausal? So the answer to that question is no, because if you still have your ovaries, you would still be making estrogen, and it's not assumed that you are perimenopausal. You would still be able to have the symptoms of menopause, such as the hot flashes, but you won't have irregular periods. Okay, back to, okay, we have D. All right, let's see what the answer is. Okay, it's C. So the most bothersome symptoms occur for women between the age of 50 and 54. And those symptoms can last for 7.5 years. So that is a very, very long time to be suffering in silence. So please don't do that. And please contact your OBGYN if you are suffering. All right, so what are these symptoms of menopause? It is really sad, but sometimes these can be just dismissed, and women can just say that, oh, it's okay for me to have mood swings. I always have mood swings. It's okay for me not to sleep well. It's normal. But if you're experiencing these things and they are affecting your lifestyle, there are treatment modalities and different things we can do to help you. The most common symptoms that we see are listed in this diagram: mood swings, sleep disorder, irritability, hot flashes, headaches, difficulty concentrating, or what we call brain fog, loss of libido, and joint pain. But you are not alone in this. If you look at this chart, specifically, it's broken up by age. So women age 45 to 50, in this study done by Aisha Khatun at a tertiary care center, it shows that there's 75% of women who are also experiencing hot flushes and sweating at the ages range of 45 to 50. Another high one that you can see is physical and mental exhaustion in the age range of 56 to 60. That's 83.3% of women. And then joint and muscular discomfort is also pretty high in the 40s to 50s as well. So if you are experiencing these symptoms, to some extent, yes, it is normal, but it is, still something that you should seek care for. So let's kind of talk about the pathophysiology behind this. So estrogen is a very important hormone for many organ systems. We think that estrogen is just important for our uterus and having babies, but actually there are estrogen receptors on multiple different tissues of different organs. For example, in our brain, estrogen helps to regulate body temperature, helps with memory, mood, and emotions. In our in our liver, it helps to decrease cholesterol. In our bones, it increases bone mineral density. In our skin, it regulates collagen, elastin fiber, hyaluronic acid, and then also it is protective for our cardiovascular system as well. So when we go into the perimenopausal period, our estrogen levels are decreasing very rapidly. If you can see right here, this depicts menopause. This is estrogen throughout the life of a woman. And menopause is the rapid decline of estrogen. And when this happens, our organ systems essentially have withdrawal symptoms from estrogen, which leads to the most common symptoms that we see. Now, talking about the most common symptoms of menopause, out of these five, hot flashes, and that's supposed to say night sweats, menstrual irregularities, insomnia, weight gain, decreased libido, what is the most common symptom of menopause? You guys can put your answer in the chat. I'll give you a second. Okay, so I see A. Let's see what our answer is. It's actually menstrual irregularities. Now, this is just a little breakdown of the percentages. So 90% of women who are experiencing perimenopause will have menstrual irregularities. Hot flashes and night sweats are close second, 80%. Now, not all of these 80% will be considered moderate to severe. Some of them will just be mild symptoms, short term, or situational, but 80% of women do attest to experiencing hot flashes and night sweats. 45 to 60% will experience insomnia. 30 to 40% complain of mood swings and depression. 40% report cognitive changes, and 50% report musculoskeletal and joint symptoms. And a whopping 60% report decreased libido as well. All right, so talking a little bit about why we're having these heavy and irregular bleedings in the perimenopausal period. So on average, our periods in the early 40s are shorter cycles, and then in the late 40s, they start to get longer, greater than 28 days. And this is all due to the imbalance of estrogen and progesterone. If you look at this chart, it kind of shows the hormone levels throughout our menstrual cycle. The follicular phase is dominated by estradiol, which is the active form of estrogen. The luteal phase is dominated by progesterone. As we have absence of ovulation, this balance of estrogen and progesterone is off. And then progesterone, as it starts to decrease because you're not ovulating, so the lining of your eggs makes progesterone. So as you don't ovulate more eggs, you don't have progesterone. Your luteal phase will start to shorten because there is not as high of a progesterone. So in our early 40s, our cycles get shorter. And then in our late 40s, when we don't ovulate at all, we don't have estrogen or progesterone, then our cycles start to get longer. And there's longer periods where you will go without a menstrual cycle. Estrogen stimulates the lining of the uterus, and progesterone stabilizes it and makes it thinner and less apt to bleeding. So as we are transitioning into perimenopause and the progesterone is decreasing, then we have a higher risk of having these heavier periods. We often see women in their 40s coming to the emergency room with hemorrhaging and complications that require like admission and treatment. And this can lead to iron deficiency anemia and need for blood transfusions, need for like IV iron infusions as an outpatient. But the mainstay of treatment for heavy menstrual bleeding is giving back the progesterone and lengthening that luteal phase that we see here and stabilizing the lining. So that's kind of the reason why we see heavy and irregular bleeding in perimenopause. Okay, so vasomotor symptoms such as hot flashes, night sweats, and also palpitations. This is a sensation of warmth, skin irritation, and perspiration moving from the trunk to the head before spontaneous dissipation. There is this sense of anxiety, heart palpitations, and formication, which is a hallucination of feeling of insects crawling in or underneath your skin. For certain women, this can last for just a few seconds, but for others, it can last for up to several minutes. And then the pathophysiology behind this is decreasing estrogen has an effect on the hypothalamus, which is a center in your brain that controls temperature. The estrogen going down confuses the body that it's too hot, and the brain responds by sending out a red alert to the heart, blood vessels, and nervous system that we need the body to cool down. Then the heart pumps faster, blood vessels dilate or get bigger, so more blood can be circulated to the organs, and this subsequently activates the sweat glands as well, leading to hot flashes and night sweats and palpitations, as we see our woman here experiencing. Now, these are some things that I thought was really important. These are predictors of hot flash duration. Shorter are certain ethnicities, no, and then obviously not having any stress, which is almost impossible. And then longer would be less education, depression, anxiety, financial strain, being single, being a smoker, having poor social support, and obesity. And it is pretty significant if you look at the results from this study that was published in JAMA. So for example, shorter hot flashes are experienced by individuals of Japanese and Chinese descent versus African American, and that's 4.8 to 5.8 versus 10 years. Having a college education versus not having a college education, 7.7 versus 9.9. Being stressed never versus being stressed sometimes, 8.9 versus 10.8 years. So, you know, it's important to see if you fall under any of these longer categories. Okay, sleep disturbances. We like to think that our sleep is disturbed in perimenopause due to these nighttime awakenings with hot flashes and night sweats, but rather it appears that there is another underlying nervous system or brain signaling that happens. Also, progesterone is known to help with sleep. So as our progesterone is decreasing, it is also affecting our sleep patterns as well. So that's important, something to remember. You know, we talk about like hormone replacement therapy and like its multiple effects. So the progesterone that we would give back can also help with women who are experiencing sleep disturbances. Okay, musculoskeletal changes. If you remember back to the diagram about estrogen affecting all the different organ systems, joints, muscles, and bones all contain estrogen receptors, and aching and pain are very common complaints that we start to see in this age group. We can also have increased diagnoses of frozen shoulders, increased risk of fractures, especially if you have a low BMI and weigh less than 126 pounds. There's also diminished muscle mass and strength. If you see female testosterone along with male testosterone does decline with age, And this can lead to decreased muscle mass and strength. And then lower testosterone is also the pathophysiology behind why we see fatigue and weakness in the perimenopausal period. Okay, mood, cognition, and sexual function. Now, this is something that is more of a late menopause transition. So it's more so occurring in those final years. Depressive symptoms, a new diagnosis of moderate to severe depression does increase during this time. There's certain individuals that we as physicians want to keep a higher check on because they are at higher risk. If they have a history of prior postpartum depression, they have a history of major depressive disorder or premenstrual dysphoric disorder or PMDD. These changes in the perimenopausal period can lead to diminished ability to concentrate, verbal memory, and processing speed are decreased. And this is also known as brain fog. Libido and sexual function also decrease in this transition as well due to decrease in estrogen. Okay, and then something that is more common in the postmenopausal time, but I just thought it was very important to bring up is the general urinary symptoms of menopause. This can lead to painful intercourse, vaginal dryness, friability of genital skin, inflammation of the urethra, painful urination, increased urinary frequency, and recurrent urinary tract infections. So these are all symptoms that are all related to perimenopause. Okay. By 2030, how many postmenopausal women will comprise the world population? Any answers for this? Let's see. Okay.
Someone else also answered in the Q&A. See. Yep.
Okay. All right. Let's see what the answer is. 1.2 billion, which is crazy, right? Because increased life expectancy is leading to having older women around, and more women will be living through these menopausal symptoms, this menopausal age. And if we as providers don't ask questions about all of the symptoms that I just described, then we'll never know if our patients are experiencing any of these things, and we'll never know if we're able to help them. So I think it's really important as patients for you guys to come to us and to be well educated on what's happening to your body and how you can get help, because 1.2 billion women will be postmenopausal, and 2030 is not that far away. All right. Yeah, so I saw this graphic on the internet, and I do believe it's true. I think a lot of women have been misled about menopause. A lot of things in women's health, as we all know, is kind of hush hush and not really put on like mainstream news and things like that. And the biggest thing is that there are established treatments that are safe and effective as long as you're having the right discussions with your provider. But women are kind of told that they just have to, quote, deal with it, and that's not always the case. So I do feel strongly about it. There's a lot of other providers that feel strongly about this as well. So yeah. All right, so getting ready for menopause. Now, what can you do as you're approaching your midlife to start to prepare for menopause and enter this period as healthy and as well prepared as possible? Maintaining a healthy weight. This, of course, can be done in combination of weight-bearing exercise, which is very important as bone loss increases after menopause. Relaxation techniques, yoga. If you remembered, people who are less stressed and anxious have shorter duration of hot flashes. So if we can start to establish these healthy lifestyle techniques early on and take them into our menopause transition, it's very important. We also want to start looking at reducing the risk of cancer and heart disease, avoiding smoking, limiting alcohol to no more than 1 drink per day, which is 5 ounces of wine, using sunscreen, avoiding caffeine, and nicotine before bed can help with sleep. And then ensuring adequate calcium and vitamin D intake. Now, this I think is really important, something that we aren't necessarily always doing because it is pretty hard to get this amount of calcium and vitamin D from our diet. So that's 1,200 milligrams per day of calcium and 800 international units of vitamin D. And then, of course, visiting your friendly OBGYN annually, even though pap smears are no longer indicated annually for the majority of patients, it's still important to come for your annual exam. All right, so I wanted to do kind of like a most common chief complaints. I feel like we see patients come in for these types of things all the time, and it would take me a really long time to go through every single like treatment modality, but I wanted to break it up based on the most common chief complaints that we get. So, doctor, I have weight gain, especially around my abdomen. So when this happens, it is unfortunately a common occurrence from menopause. Things that can help with this: diet, exercising 150 minutes per week, working with a nutritionist, whole food diet, high in fruits, vegetables, whole grains, protein and dairy products, and of course being plant-based if possible. Having green tea 2 times per day has also shown to have good effects on reducing your visceral or your abdominal fat. A lot of women ask me to go on hormone replacement therapy to lose weight. There are studies that show that the weight loss from hormone replacement therapy is very minimal, only 1 to 2 pounds. So in that type of a scenario, looking at risks versus benefits, I think I would not advise that because all treatments and medications do come with risks associated as well. Next, doctor, I have vaginal dryness. Most providers usually start off by recommending over-the-counter lubricants with sexual activity. Silicone base lasts longer and are more slippery. I love the brand Uberlube. You can get it on Amazon, works really well, and it's fairly affordable too. Also, you can try vaginal moisturizers such as coconut oil, Replens, Reverie by Bonafide. These are like hyaluronic-based moisturizers, hyaluronic acid-based moisturizers, and can be purchased over the counter. However, the mainstay treatment and the most effective treatment for vaginal dryness or those genitourinary symptoms of menopause that I talked about is vaginal estrogen. There's a lot of data that shows really promising results and almost very few side effects, and very few women are not candidates for vaginal estrogen. This is different than oral or topical estrogen hormone replacement therapy. So I do recommend if you are experiencing vaginal dryness, pain with sex, that vaginal estrogen is something you talk to your provider about. It's very safe. Okay. All right. So doctor, I have hot flashes, vasomotor symptoms. Oops. So one of the first things we will talk to you about are lifestyle modifications, sleeping with a fan, having a portable fan, getting those cooling sheets, wearing minimal clothing at bedtime, and avoiding alcohol, spicy foods, and caffeine. If these lifestyle modifications are not effective or you present with moderate to severe symptoms, then we will talk to you about medical management. There are studies that look at black cohosh, which is a supplement that can help with vasomotor symptoms, but the mainstay treatment is hormone replacement therapy. NAMS, which is the North American Menopause Society, this was their position statement. Hormone replacement therapy remains the most effective treatment for vasomotor symptoms and the urinary symptoms of menopause, and additionally has been shown to prevent bone loss and fracture. So don't be afraid to talk to your doctor about hormone replacement therapy if you have moderate to severe vasomotor symptoms. There are also other medications for women who are not candidates for hormone replacement therapy. These are kind of used off-label, but Paxil, which is an antidepressant, gabapentin, which is another like pain medication, and then there's a new medication called Veoza as well, that is a non-hormonal medication to help with vasomotor symptoms. Bottom line, talk to your GYN. Okay, doctor, I have hair loss and skin changes. So when we see this, the big thing I want to rule out is thyroid abnormalities, vitamin deficiencies, iron deficiency. We will recommend you be taking a multivitamin, can trial topical treatments like Rogaine. And then there is some data that hormone replacement therapy can increase skin thickness and lead to stabilization of like the hair follicles, which can prevent increased hair loss. So would I start a person on hormone replacement therapy just if they're experiencing hair loss? It's a discussion to be had, but it is like an added benefit if you are experiencing other things that it can help with hair loss. Doctor, I have decreased libido. So we can start off with sex education, counseling, increased foreplay, scheduling sexual activity. A lot of my patients do say that this is something that helps overcome their decreased libido. Of course, exercising, avoiding smoking, drinking, and drug use are all things that can help as well. There are new medications out there that are helpful. They do have side effects, and not necessarily everyone is a candidate for them, but there are medications to help increase if you do have hypoactive sexual disorder or hypoactive orgasm disorder. So the medications are listed there, Addyi, Vyleesi, and then of course hormone replacement therapy can also help with this too. Okay, in summary, it is totally impossible to predict a particular person's menopausal experience. There are multiple options, however, available for management if these symptoms occur. And then treatment should always be individualized to a person's needs. And then, I do think like being educated and going into this transition period with multiple resources underneath your belt is important. These are some books that I think are really important. Hot and Bothered, I think, is an excellent read. I feel like all women should read that. Read it, go to your book club, share it with your friends. I think it's has a lot of information, and it's written in a way that is presented to be understood by like everyone, not even if you don't have a medical background. I also love the podcast Women's Health, and then there's a couple Instagrams that you can follow that do actually have good medical information about menopause. And then of course your OBGYN. So